My name is Jessica Carlin. My student number is 001063330T. I'm studying an advanced diploma of nutritional medicine and the subject is anatomy and physiology. My subject code is C4MAAP13 and I'll be demonstrating the client history and vital signs practical.
I, John Sinclair, on this day, 25th of May 2014, agreed to the inclusion of my contribution to this DVD video assessment, the nature of which has been explained to me. I understand that an assessor at the college for the purpose of assessment and marking will view my contribution. I'm over the age of 18 and have agreed to be part of this DVD video assessment on a voluntary basis. I understand that this DVD video assessment or part of it may also be used for the purpose of further review at the college or used in moderation for validation processes. I understand and agree that my personal details and this DVD video assessment will be stored and archived in accordance with the college policy and procedure. I have read and understood the college privacy policy and procedure found at www.thinkedu.au /policies and forms. My contribution has, to the best of my knowledge, been truthful and honest. I have not deliberately sought to conceal any relevant facts from the makers of this DVD video or the assessment reviewers.
Jake Anderson. Hi Jake, how are you? I'm Jess.
Thank you.
Nice to meet you.
You
Come
too.
take a seat. Okay, so I'll be your nutritionist for today. I recently read over your medical health questionnaire and we'll be discussing with you the main body system affected by your symptoms, the importance and the key factors for maintaining this body system. I'll then be conducting a vital health check including measuring your heart rate, your respiratory rate and your temperature. I'd like to confirm with you that as a nutritionist, I'm only to treat your symptoms in regards to dietary patterns and intake to assist in maintaining overall optimal health. If you require any further treatment out of my scope of practice, I must refer you to another health practitioner who specialises in that particular field. Are you alright to go ahead with everything today?
Yeah, that's fine.
Okay. Alright, so can you please point to the location of your problem area for me?
Well, it's mainly all my gums are sore, but it's mainly these two here, and then you can see that they're sort of receding at the gum line, and it's just when I'm brushing, or if I eat something that's really sweet or something like that, it just gets a bit sensitive.
Okay, and can you describe to me what it feels like?
It's just like stinging pain more than anything.
Okay, alright. So after reading your answers to the medical health questionnaire, it seems your main issue is in relation to your teeth and your gums. I'm able to provide you with some nutritional information to assist in maintaining your oral health, which in turn will assist in the maintenance of your overall health status. This will include dietary changes as well as some lifestyle changes for you. Although for further treatment, I'd like to refer you to a dentist or oral health practitioner. We'll further discuss this at the end of the session. Is that alright with you?
Yep.
So as you may know, digestion begins with the physical and chemical processes in the mouth. Poor oral health can in turn lead to intestinal problems and other digestive disorders. The digestive system begins with the oral cavity, the mouth, and descends along the alimentary canal which connects to the esophagus, the stomach, small intestine and large intestine, and lastly the rectum. Other organs involved in the digestive process include the pancreas, gallbladder and liver. On your medical history and health questionnaire, you explain that you're experiencing the following symptoms on a daily basis and they first started about 2 months ago and have been progressively getting worse since Anzac Day this year. You explained that you experienced receding gum line, sensitive teeth, bleeding gums, sore, tender and swollen gums as well. You also explained on your medical questionnaire you noticed the symptoms getting a little bit worse after drinking and also followed by a few days of straight drinking. You said that you mainly drink whiskey and rum. Some of your symptoms in the oral cavity may be diet related or may improve with a change of diet or an alteration to certain foods and drinks consumed. Firstly, I'd like to suggest, unfortunately, to limit your alcohol intake over the next few weeks. So no more than one standard drink every day. What do you usually have?
Usually whiskey and Coke.
Yeah, and how often per day?
Depends. Every now and then I'll have a week off, but usually it'd be one a day or one every few days or.
Alright, so if we can limit that to one, that's pretty good anyway. So if we can limit that to one every few days and possibly one every week, just until your symptoms get a little bit better. So not only does drinking alcohol, it dries your mouth, it also reduces the saliva in your mouth. So it creates a more acidic environment which can soften the enamel on the gums. A main function of saliva is to wash away food and neutralise acids produced by the bacteria in your mouth. This in turn helps to protect from infection and bacterial overgrowth in your mouth, which can lead to disease. So receding, tender and bleeding gums might also be a sign that your body isn't able to sustain healthy tissue in your mouth. Receding gums may also be accelerated by an imbalance of calcium or phosphorus ratios in the bloodstream, which can in turn result in a loss of tissue function and health. So also excessive intake of simple and added sugars in the diet can further deteriorate your tooth enamel. So I'm sure you're aware of this, added sugars. So there are a few dietary changes that you can make to assist in the maintenance of your overall health. This may limit the progression of the symptoms, heal the damaged tissue in your mouth and prevent any further damage to your oral cavity or further damage to your body organs as well. I've noted these down for you to review after this session. I'd like you to make sure that you're drinking plenty of water every day. You can also use herbal remedies such as white oat bark powder to limit or even heal your gums. And I also strongly suggest that you consume the recommended daily intake of all the food groups, especially the fruits and vegetables, to assist in your overall health. So some foods can include acidic fruit, low acidic fruits, carrots, celery, small amounts of low fat and sugar dairy, and also cashew nutshell oil. So I stated earlier to make sure you reduce your alcohol intake as well as your sugar intake, especially added sugars. There are a lot of natural alternative sugar options which you might like to try, such as stevia in your coffee instead of raw sugar. Also try to reduce stress factors which may result in gum recession, such as teeth grinding. Are you a teeth grinder at all?
I think so, because my teeth are a bit flat around the top.
Yeah, alright. So there are many reasons which are stressed to you that it's important to maintain your overall oral health as well as your digestive health. So poor oral health can affect other areas of the body. As I mentioned earlier, this is due to the fact that digestion begins with the mouth and in turn all leads to other organs and systems in the body. Maintaining oral health also assists in the production of saliva, like I said before, which washes away and neutralises acids produced by bacteria in the mouth. This helps to protect from bacterial overgrowth that might lead to diseases in the mouth and spread to other areas of the body. An example of this is the bacterial plaque that can travel from your mouth all the way down to your lungs and can also cause infection or aggravate existing problems with your lungs. To prevent or reduce risks of further gum disease, it's important for oral and digestive system to be functioning well to maintain your overall health. Your condition is very common in a country which thrives on processed high salts and fats and sugar foods. Our best option is to make sure that you receive adequate intake of nutrients from each food group and limit your consumption of added salts and sugars and fats, especially trans and saturated fats. This will greatly assist in healing your oral and digestive system and help in the maintenance of this body system in the short and, more importantly, the long term. So I'll now be conducting a vital signs health assessment to ensure that your vital signs such as your resting heart rate, your breathing and your temperature are within the normal range, and to make sure that you aren't at risk of any certain diseases. So firstly, I'll sterilise the thermometer because we'll be taking your temperature. So I've just got some alcohol wipes here which I'm going to sterilise the end of the thermometer just to make sure it's extremely clean. Okay, so I'll now take your temperature by placing the thermometer under your arm, also known as the axillary region. The results may vary slightly because it's under your arm, but as we know, we can't really take it from the mouth because you've got inflammation around that area. So the axillary region will be the best option today. So what I'll get you to do, I'll just get you to lift up your arm for me and I'll place the temperature on the thermometer under there. Okay, and just place your arm down. It won't be too long. Okay. So usually we do take the mouth area, but yeah, we can't take it today just because it might cause some more problems with your gums and your teeth. So we'll just take it under the arm. Okay, so your current body temperature is 36.7 degrees, so that's within the normal range of 36.5 and 37.2, so that's very good.